The latest figures are just out as India has recorded a marginal decrease in the daily COVID cases at 5,676 cases that have been reported compared to the previous day. Whereas on Monday, the total number of cases that were recorded were over 5,800 cases. So a marginal dip that has been reported even on the sidelines as the Union Health Ministry continued with its nationwide mock drills to take stock of the preparedness in both public and private hospitals in the wake of the surge of COVID cases that have been reported across the country. Even states and union territories assess the COVID preparedness, and the health authorities directed mandatory use of masks in hospital premises. Now, this has been a marginal dip today, Rishabh, that we are recording. In the last 24 hours, India has registered 5,676 new cases. Rishabh.
So, well, if you see, yes, India has seen a marginal dip in the cases. There have been a lot of meetings that have been going on. We have seen mock drills happening in national capital as well as different parts of the country as well. In last 24 hours, Health Minister Mansukh Mandavia has also spoken to the health ministers of different states, and Health Secretary has also sent out letters and precautions that need to be taken. Remember, there were issues that the government of India flagged that the COVID testing in many states are below the national average, and that needs to be up. So the state governments are now upping the game to ensure that the testings happen, and there's no relaxation when it comes to testing the patients who show symptom of COVID-19. Yes, there is a marginal dip, and we have seen months high in last one when it.
Akansha is also with us with more additional information, because Akansha, a slight dip there, but we are told Monday and Tuesday are the 2 days when the mock drills nationwide will continue.
Well, absolutely. Yesterday, the mock, as we had reported also, it is a 2-day mock drill. And yesterday, Union Health Minister visited RML Hospital in the national capital to oversee the preparedness and the operational readiness of the hospitals. Now, this is now the special focus is being put on the availability of beds, ventilator, oxygen plants, medicines, human resources, and if the situation goes out of hand. Currently, today the country reported 5,676 cases in the last 24 hours. The active cases are 37,000. And remember, last week, Union Health Minister had held a virtual meeting with the state health ministers to review the preparedness, because that is the most important and the focus of the Union Health Ministry. He had this time emphasized on fivefold strategy of testing, tracking, treating, vaccinating, and also adherence to the COVID-appropriate behavior. Here is the state ministers.
Well, we'll talk about the different states and the spikes that have also been reported there. Akansha, please to stay on with us. Deepak is also joining us from the newsroom to help us understand, as far as the state government saying that they are faced to they are prepared to face any eventuality, Deepak, in the wake of cases that have been reported.
Right, Amita, we saw how last week the Union Health Minister held a meeting with the states and union territories to, to inform them that the COVID spike will require ramped up medical infrastructure, and the states are now ready. But let me take you all through the stats, because 5,600 new cases have been reported, out of which 37,093 are still active cases. Now the discharge figures have also been rising. The deaths, however, have also increased. Now let me take you all to the states data, which shows that which state is on the boil. Here, currently Kerala has recorded about 13,745 active cases, and the new cases, new spike is 1,312, which remains the highest, individual spike reported by any state in the country, and that has increased the entire tally from 37,000 of the active cases by 1,894. And we can see how COVID cases across Odisha, and then we have Rajasthan and we have Tamil Nadu as well, with with spikes being recorded each and every day. But the focus right now lies in Kerala, because Kerala has been reporting the highest number of individual, daily spikes.
And that is also something, Deepak, thank you very much for the moment. Akansha, as far as the spike in Delhi also being reported, what has been the work that is also being done, as Chief Minister Kejriwal has been saying that they have been conducting several review meetings? Akanksha?
Absolutely, I can hear you. And that is what the Union Health Minister had advised the state is to be on alert, increase the testing, and that is why we will now also see that testing has also been increased by the states, and that has also been reported by the Union Health Ministry. Now, remember, last week Union Health Minister had advised the states two things. First of all, they were advised to be on alert, keep all the preparedness for the COVID management. Secondly, they were also asked to ramp up the vaccination of the eligible population, especially of the vulnerable population group, and that is states are now in Delhi. More than 700 cases were reported yesterday and also day before yesterday, and that is why the government here is also on alert, with most of the country witnessing a rise in COVID cases in the last few days. Several states have also made masks mandatory again, while some other have advised to observe caution. So the cases are still rising. Today, India reported 5676 cases. The active caseload is 37,000.
All right.
Today is the second day of the mock drill. Hospitals are also...
Akanksha, thank you very much for the moment. As we are continuously getting you those updates, we are